Welcome to your Joyful Riches podcast, where you gain precious tools and tips for creating an even more beautiful, thriving life. This podcast is delivered alongside G100 Global Networking. And we are so super honored this week to have Chantal with us. I probably mispronounced your name to start with, so please correct me. But Chantal, please welcome firstly. Thank you so much for joining us today. And would you care to share with our audience what is it that you do?
First of all, you got my name perfectly well, Brigitte. It's Chantal Donnelly. Yes, thank you. And thank you for having me here. What I do, I am a physical therapist and I am a stress expert. And I just finished writing a book. It's called Settled: How to Find Calm in a Stress-Inducing World.
How to find calm in a chaotic world. That is so awesome because I feel that is something that, let's just see. I would love to know a person who does not feel that the world is a rather interesting place right now. So what a beautiful timing! What a beautiful timing. So what brings you into doing this? Becoming a physical therapist, but even more being a stress expert. But did you kind of like grow up and say, you know what, stress just sounds so cool? And I want to become a stress expert, or is it something else lead you into a stress expert and writing the book that you have?
Yeah, actually, yeah, it was connected to my physical therapy. I had been practicing for about 20 years and I was enjoying my practice. Patients were getting better on my table. And I got to a point where I started really seeing a pattern with my patients. About 80%, maybe more of my patients, I could unwind their connective tissue on the table. I could exercise and education about the body. And they would feel better leaving my clinic. And then they would go back to their stressful life, their stressful job, their stressful whatever it was. There's so much turmoil out there in the world. And I would find that all of that stress would undo all of the unwinding that I had done, and all of their connective tissue and inflammation would get dysregulated again. And so I started getting a little frustrated with my attempts to help my patients. And at the same time, I was going through a lot of stress myself, and I was feeling all of the negative consequences of that, insomnia, body aches and pains, brain fog, you name it. I had the symptoms of a stressful life. And so I started thinking, oh my gosh, I need to tackle this so that I can become a better physical therapist and a better human in my life with my son and my husband and my friends and my parents and, all of that. So I started doing a deep dive into the stress science and thought honestly that I was going to be changing careers. I thought I already had an undergrad in psychology, and I thought, well, I'm probably going to have to get a degree in psychology, a PhD or something of that sort. But as I started looking at the stress science, it became really clear to me that actually my knowledge of anatomy and physiology and my experience as a physical therapist was the perfect foundation for looking at stress, because stress starts in the body. And if we can talk more to the body, listen more to the body, and really understand the body's language, then we have a way of communicating to the body and the brain that everything is okay, and that can help to lower our stress. And I think a lot of people, they try to tackle stress with mindset and meditation and positive thinking and even self-care, and run into a wall and start to feel like something's wrong with them. Like, why isn't this working? I'm still super stressed out. And I found through the body a completely different way of looking at stress. And it was so exciting to me. The information was so great that I started telling it to patients and incorporating it into my practice. And so much so that people said, you should write a book about this. This is really, really good stuff. It was really resonating with everybody. So I did.
That is so awesome. So you, and I love you mentioned that, because so in your experience, I have two questions. The first question would be, in your experience, we know with grief, while there is a place for positive thinkings and the mindset thing. With grief, positive thinking or just positive thinking, it's actually invalidate, and a lot of times make grievers feel worse. But it's very interesting. So you find saying affirmations, for the 1,000th time, that I'm healthy and flexible and feel comfortable in my body. And doing that on a massage doesn't do it.
That's what a lot of my patients and I was finding. It was almost like we were checking things off the list that we were told were going to help us. And when it didn't, you start to wonder, well, maybe I'm a weak human being. I don't have any resilience. Maybe there's something wrong with me. Everyone's telling me that this should make me feel better, but really, is it helping everybody? And you mentioned grief. There's a lot of uncertainty and change with grief that comes along with grief. And we know that the brain analyzes uncertainty and change as a threat. So there's a lot of stress with grief, right? And so just trying to talk yourself out of it, it's almost like trying to talk to a toddler who's having a tantrum. Like, you can't reason with a toddler when they're in the middle of a tantrum, right? It's just like you can't reason with those uncomfortable feelings in your body, because the brain is trying to say, like, no, everything's okay. And these uncomfortable feelings in your body are saying, no, there's something wrong. I don't feel good. I don't feel good in my body. And what I found is that really talking to the body, through the body, can then help the thoughts ultimately, right?
I love that. So it's, in other words, a lot of time nowadays, I think it's very interesting. In the past, it was all about powering through with muscle, right? And then nowadays, the trend, so to say, is all about mindset. Use your mind for everything, and if you can create it in your mind, you can create it in your life. And I think there's probably a place for that. But your recommendations for certain people, apparently that might be different, but for many people where it doesn't work, to actually kind of come from the body out, from the bottom out, instead of out here out there, and then in the mind and going down, to actually address it from the body, and sounds almost like allow your body to guide you. Am I capturing this correctly?
You are. Yeah. Yes, there is a place for mindset. Generally, mindset works best if you are working on goals, something more chosen as far as your reach into uncomfortable, right? As we would say, you got to push yourself out of your comfort zone. And that's when mindset really does work. When it doesn't work is when your goals or your life situation is very stressful. Grief is a good example of that time when mindset might not be the first tool you want to reach for. So really, yes, talking to the body can actually allow the thoughts to follow, and then the mindset will work better. It has more stick.
I love that. That's very interesting. So what are a couple tips that you might have for people that say, okay, so how do I know who to reach out to? I mean, they can actually, firstly, let's talk about your book, talking about reach out. Tell us a little more about your book. We hear how you got into your journey into writing the book, because what you do works so well. Tell us a little more, if you may, about the book, so our audience can feel if this is something that will be good for them, or somebody they know.
Yeah, sure. The book is divided into two main parts. Part one is the foundation, and it is when, why to use a settling tool. So when would you want to calm your nervous system down? There are certainly times when you need a small amount of stress, a moderate amount of stress, to propel you forward, to give you motivation, to give you some sort of oomph for your goals and your dreams. And then there's also times when you're in a terrible situation and stress is going to help you move out of that situation. And it might not be appropriate for you to use a settling tool. So I spent a lot of time in the first part of the book really talking about when you would use a tool and how you would know it was time to use a tool and why you would use a tool, right? So all of the when and why type questions get answered in the first part. The second part is the tools. And I talk about things that people might think, oh, I already know about that, like breathing, for example. But I explain what it is that breathing is doing, all those breathing techniques that people use to calm down. I explain the physiology behind it. And I also talk about some pitfalls that we might run into. Say you're using a breathing app, for example. No one's watching you, so they might not notice that when you're inhaling, you're bringing your shoulders up towards your ears, right? And you are activating muscles right here on either side of your throat called your scalene muscles. Well, those muscles are only used for breathing in a fight or flight situation. So a lot of us are in survival mode, and so we constantly overuse these muscles. And what happens is it's a negative feedback loop, and we find ourselves trying to do these breathing techniques. We're diligently using our breathing app and trying to calm down, but we're overusing our scalene muscles, which are already tight because we're in survival mode. And that sends a message up to the brain like, oh, we're in an emergency. We're using our scalenes. So teaching people how to breathe properly so that you are actually sending a message of everything's okay. We're not in an emergency here. And that allows the brain to change the thoughts and to now calm the nervous system down, calm your heart rate, calm your breathing down, and all of that. And then you feel better in your body.
I love that. Many people don't realize, sounds like what you're saying there is, it's wonderful that you share this technique, but even more the pitfall. How many people? Let me ask you, for anyone listening here, how many of you think that something as breathing? We all hear about the breathing technique. This breathing technique. There's about 10,000. Every client who came to me and I said, so we're gonna do certain breathing. They're like, I'm already doing it. I'm like, I hear you. Just you already pay me. Listen. and then usually the next meeting they say, oh yeah, that was different.
Right.
But anyhow, but also I love how you said the pitfall. How many times we even think that you could be intending doing a breathing technique that you learn or hear from your friend or your boss or your therapist. Here's breathe this, and then you actually firing up your fight or flight and getting you deeper in the hamster wheel, sounds like.
Exactly. Yeah. And so every chapter in the second part of the book is exactly like that. So let's do a deep dive into breathing and where you might be going wrong and what you might be doing right, and really giving you the understanding of how breathing does help calm the nervous system. I do the same thing with movement and exercise, because I think a lot of people over exercise or might have an aversion to exercise and not really understand why they can't get themselves to go to the gym, even though they've promised themselves, and they actually feel really good when they're there, but they may be having a reaction to the adrenaline that's being released during exercise. And of course, adrenaline is also what we release during fight or flight. So there's a confusion going on between the brain and body there that I talk about rewiring and realigning. Let's see, I talk about stretching and whether or not that helps to calm the nervous system and what kind of stretching might do that. I talk about using your senses, and I have a chapter on eating. and how we can approach our relationship to food in a calmer, more settled kind of a way. And then I've got 4 chapters on connecting with others and how that is indeed a tool and what we can do when we disconnect with others. I have a lot of tools for what to do if you're in the middle of an argument and you want to sort of back away from the argument and be able to discern the difference between danger and uncomfortable feelings in your body during an argument and what to do there. And then I talk about rushing, because that is a biggie in our world. We're all rushing around and trying to make our lives better and hopefully the world a better place. But in doing so, that speed of movement and that speed of our thoughts and of our heart rate can really send a message of danger up to the brain. And that's what's causing a lot of our thoughts. And so really kind of tackling the art, I call it, that's what the chapter is called, the art of rushing. And then I have 2 chapters on when you're reaching for a goal that can cause stress, and stress can sabotage your goals. So how do we reach for goals without having our goals shut us down? So lots of information all over the place. There's probably about 30-ish, I haven't counted them, but about 30 tools that you can do before, say, a difficult conversation with someone or something you know is going to be stressful, during a stressful event, and after.
That is so awesome. I love that. I mean, let's just ask for our audience, if you how many of these you do talking about rushing. It's very interesting. I caught myself, as you said, it's kind of like can turn into a negative loop. I caught myself this morning, actually. I suddenly like, I'm rushing. I can feel my action still organized, and many times people don't even realize this. Sometimes they just catch themselves in like a running around, but my action's still organized, but I can feel like my energy starting to move toward rushing. Now I've trained myself so well that I can catch myself and say, okay, Brigitte, you're rushing. Pause. Get back. But for any of us here, and it's something that let me ask you, anybody, if you practice any of this, where do you do breathing? Do you do stretching? Do you exercise? And talking about eating, the holiday is coming up. Apparently, sounds like we all want to check out your book for that piece alone, because talking about eating and holiday time and connecting with each other as well, which is also a lot of time we do more this time of the year when we're connecting, and then you go to a holiday party, and if anything, like many people experience, you suddenly, particularly with the way the word nowadays, when you say it's Chantal, but the way the word nowadays, you start talking to somebody, and before you know it, you're like, wait, where was that? We thought we were trying to make friend, and we suddenly be like enemy. So,
yeah,
with so many conflicts going on, and then for goal setting, sounds to be like, yes, you mentioned earlier, there are times you don't want to settle. But and perhaps there are certain times you don't want to settle. But if you do any of this, for anyone who's listening, if you do anything like eating or connecting or breathing or exercising or stretching, it sounds like a wonderful things to check out for your book, to check it out. Where do people find your book?
Thank you. Yeah, the book is available pretty much anywhere books are sold online. For those watching, this is what it looks like. That's the cover there. It's available. I'm working on the audio book that probably will be available around the holidays, I'm hoping. And it's available by ebook and paperback and hard copy right now.
That is wonderful. So it is available on Amazon.com.
Yes, and BarnesandNoble.com. And yeah, I'm hoping to get into some independent bookstores soon. And people can also reach me through my website, I have a company called Body Insight. So my website is bodyinsight.com, and they can sign up for my newsletter and hear about book events or workshops that I'm doing, that kind of thing. And on Instagram, I have a lot of videos of 30-second down regulation tools. If you don't have time to make it to a yoga class, if you don't have time to exercise, although I highly recommend exercising as a physical therapist. But there's lots of people with injuries and illness and chronic pain, and there's all sorts of reasons why people may not be able to move as much as they want. And so I give examples of 30-second tools on Instagram, and that's Body Insight Inc. And Facebook as well, same handle, where you can check out these tools. And those tools are also in the book, where it's really, honestly, 30 seconds is all you need. You don't need to make this big fancy, you don't need fancy equipment. It is just you and your body, and 30 seconds of just a little bit of calming. Yeah.
You and your body and 30 seconds. I love that. I'm going to check those out because who is not busy right nowadays? And so, and then 30 seconds is much more digestible, so to say, than 30 minutes. Or some people's like, go to the gym for 3 hours. It's like, who has that kind of time? Or you think that we don't have to work? So I love that. That is so awesome. So we all want to go check that out. And just one more question. With the so let's say people's going through life right now, a lot of us going through life, having a lot of stressful event, and sometimes it's one after another. What is do you have any one or two suggestions as we're going through life and kind of like one after another thing happening, whether in both in our personal life as well as in the world? What would be one or two tips that you can give people who are listening to this right off the bat?
First, I would say don't pathologize the fact that you are under stress. We do live in a very stressful time, and your body is designed to go in and out of stress and relaxation. So if you feel yourself getting stressed, that is totally normal, and it's a biological response by your nervous system. You don't necessarily have a choice there. What happens with humans is we tend to get stuck in stress responses. And so if you're finding that you're having trouble coming out of a stress response naturally, which honestly, most of us are, then that's when you're going to want to use a tool. And my next tip would be not to always assume that your mind is going to be that tool. As I have said before, the body is oftentimes, when we're really feeling stressed, a better way to approach to do that body up discussion between your brain and your body, right? Because there's that two-way street between the brain and the body, and really talking from the body up is going to be really helpful. And then, if people are really feeling uncomfortable in their body and overwhelmed by those feelings, simple things that you can do. I mean, you can do something. I'm going to give you a tool right now. Alternating bilateral tactile stimulation. That's a big word. I'm going to break it down. So bilateral is both sides of the body. Alternating is one side at a time. Okay. So if you just take your right hand and place it on your left shoulder and just sweep your arm down towards your fingers, and then you do the opposite, left hand on right shoulder and sweep down, that is bilateral tactile stimulation, and you're alternating that stimulation. And that, for a lot of people, not for everybody, you got to figure out what tool's right for you, but something just as simple as that can slow your heart rate down, can slow your breathing down, and can send a message back up to the brain that says, no, we're okay. We're going to come out of that stress loop that we're in right now. And that can be a game changer for a lot of people.
That is such a beautiful tool. Thank you so much. I love that tools. And one thing I actually teach similar things. Sometimes we are in meetings and you cannot, you can't go doing that. or you don't want to, like people looking at you, what are you doing? The one thing I have, and if you don't mind, one
No,
thing
not
that
at all.
is an alternate to that, and like Chantal says, it can be any part of your body. So one thing I have one with client is who are in a lot of meeting is actually you can do the same thing alternating with your thigh as well. So that you do it like that, but if you don't want people to see you, you can be under the desk, or if it is a remote meeting, nobody gonna see you with chest down, right? So you can just very gently, kind of like the way mom wrap your legs, so to say, and one side and the other, as long as, probably because my work with grief, some people are that doesn't suit some people, then you wouldn't know what suits you. For many people, that those are an okay thing where you kind of like wrap one leg and wrap the other, and wrap one leg, wrap the other, and which is what Chantal was saying there, the bilateral tactile stimulation. But I just love your tools and your tips just now, which is kind of like we think about it. There is a saying, smile and you can be be happy and you smile, or you can smile and be happy and then start becoming happy. And sounds like that's what you are sharing with our audience. And thank you so much, Chantal. This is so beautiful. As we close our conversations, do you have one final message for our audience?
Oh, I have so many messages. What I would say is that those tools, and in fact, I do talk about it, the alternating, the alternative to the arm sweeps that I just showed you is under the table. So it's funny that you mention it on the legs. Yeah, I do talk about that. What we're trying to do is build a capacity to be able to hold the uncomfortable feelings. And through the body, that's how you can build that capacity, whether it's grief or stress. We have a lot of feelings in our bodies that are sending messages of feeling not right and feeling unhealthy and feeling like things are not going well. And building the capacity, I call it growing your settled section. That's what this is all about. And I think you can do it in 30 seconds. And it throughout the day, and it happens over time, and you'll notice a change if you do these little tools.
Baby steps brings you up Mount Everest, right? And so that is so lovely. And anyone who are thinking about with the holiday times here, but toward the end of the year, holiday times coming up, check out Chantal book. It sounds like something that will benefit you if you do anything like eating or connecting or breathing or exercising or stretching, and it's probably will benefit your friends and families as well. Thank you so much, Chantal. It is such an honor to have you here with us today. Thank you again for all your beautiful, beautiful tips. And for you, our audience, please share one or two gold nuggets that you learned from her today. And this way we continue learning from each other, as well as please share this discussion, these conversations with your friends and family, because we all want and deserve to thrive. And this is Dr. BirgitteTan, your United States Country Chair of G100 Global Networking and your grief specialist and founder of the International Childhood Cancer Charity. It's been such a delight to be with you again, and I look forward to see you